Hey guys, it's Dr. Kamel. We're going to continue on in our ultrasound series, and now we're going to discuss the ankle joint. Now, it is important to know that the ankle is involved in multiple different types of injuries, some related to trauma, some related to overuse injuries, and others related to inflammatory conditions. The ankle can be assessed by imaging with an MRI or a CT or an ultrasound. Now, when using an ultrasound, it is important to know that it might be difficult to use if you don't know the normal anatomy very well. So knowing the normal anatomy as well as the skeletal framework of the lower extremity will help with placing your probe and identifying the structures of the ankle. So what we're going to do is we're going to go over the lateral ligaments of the ankle as well as the medial ligaments of the ankle, and we're also going to discuss the syndesmosis, and we're going to show you how we can use an ultrasound to identify them, as well as discuss some of the pathologies related. All right, now I'm going to show you guys how you can use ultrasound to visualize anatomical structures that surround the ankle. So I'm going to discuss the ATFL, the CFL, the AITFL, the PITFL, as well as one of the deltoid ligaments on the medial side. In another video, I'm going to show you guys the medial compartment with the posterior tibial tendon, as well as a separate video for the anterior compartment with the anterior tibial tendon. But for now, we'll just focus on the surrounding ligaments of the ankle. So we'll start with the ATFL. So as you know, from the distal tip of the fibula to the talus, I'm going to place my probe. Now, one trick to know is that if I tap my finger, I can see which side of the ultrasound monitor I should expect to see the talus, since I'm putting the talus out on the distal end here. So I visualize my structure so I can see I have the fibula on the right side of the screen, and then I have the talus on the left side of the screen, and connecting them I have an intact echogenic fibular ATFL. Alright, so let's move on to the CFL. Again, I want to tap and see which side I'm on, and I want that to be where my calcaneus is for the CFL. And we all know the orientation of the fibula, or the CFL from the fibula to the calcaneus. And we can see that here. Now, I can even do a Taylor tilt test. Sorry, I'm slipping here. And I can watch the integrity of that ligament, which is awesome. And I know that in this patient it is intact. I'm not worried about any separation. I don't see any effusion. I don't see any disorganization or inhomogeneous nature to the CFL. That's great. So now we'll go on to the AITFL, which is a part of the syndesmosis. So I'm going to come up a little bit higher, again making sure I know which side is going to go to the tibia and which side will be on the fibula. Right away I see the two mounds. On the left side I have the tibia, on the right side I have the fibula, and the structure in between them that has connected them is your AITFL. And in this patient it appears to be intact. And then now we're going to go to the posterior side of the syndesmosis, making sure to identify the PITFL. So again, making sure I know which side I'm looking at. Get the posterior fibula with the tibia. This one's a little harder to find, but just be patient, know your anatomy, and you'll be able to identify it. Okay. Alright, so there we go. Got the fibula, the distal tip of the distal tibia, and then the PITFL connecting them. It's a little bit hard to see it here, but I'm going to show you guys some images in a little bit to help show that a little bit more, help it make it easier for you guys to identify. The last one I'm going to show you is the tibiocalcaneal ligament from the medial deltoid ligament complex. So, right, Now I know where my calcaneal side is going to go. Alright, and I can see here on the left side of the screen, I can see the tibia. On the right side, I see the calcaneus. And in between, a little bump in between them is the talar component. But if you see from the tibia over to the calcaneus, there's a strip of ligament that is homogeneous and fibrillar, just like any other ligament. It will look like a normal ligamentous structure. And that right there is the tibiocalcaneal ligament. And oftentimes, because we know the relationship, we can see right there, just sitting just above it, you can see the posterior tibial tendon. Now, I haven't shown all of the deltoid ligaments, and I haven't shown the PTFL, but I will show you guys in some images how to identify it with the probe placement. Here is a long axis view of the anterior inferior talofibular ligament component of the syndesmosis. And just like with the other views, making sure that you orient your probe correctly, knowing your anatomical structures, and placing your probe in the right orientation will help you to identify this ligament. Next, you can see a long axis view of the ATFL, which shows hypoechoic discontinuity of the ligament, which is compatible with a complete tear. Now, an inversion stress image would provide more diagnostic confidence regarding that complete tear, which is the beauty of using ultrasound. Here you can see a long axis view of the calcaneofibular ligament. Now remember that the CFL and the ATFL make approximately a 105-degree angle with one another, and also the CFL is maximally taut with inversion and dorsiflexion of the ankle joint. Now when using the ultrasound, you are able to manipulate the foot and see how the calcaneofibular ligament changes with respect to how you have the position of the foot. Also, please take a look at the peroneal tendons and its relationship and proximity to the calcaneofibular ligament. It is also more superficial. Here is a long axis view of the calcaneofibular ligament illustrating the concept of the dynamic component of an ultrasound that I was explaining to you guys earlier. And you can see with dorsiflexion of the ankle that the calcaneofibular ligament becomes more taut. Here's a long axis view of the calcaneofibular ligament in a patient who had an inversion injury of the ankle. Now notice the multiple areas of asterisks which indicate the areas of effusion noted by the hypoechoic space, and the wavy architecture of the ligament with the small area of a partially torn ligament. Now, although not as commonly injured, don't forget about identifying the PTFL. Just quickly place your probe on the backside of the ankle. You can see the picture there with the probe placement, and make sure that you are oriented in the correct axis from the fibula to the posterior aspect of the talus, and you will see there the ligament, which the normal concepts apply from previous videos and previous images on identifying a ligament. Here is a long axis view of the anterior inferior talofibular ligament component of the syndesmosis. And just like with the other views, making sure that you orient your probe correctly, knowing your anatomical structures, and placing your probe in the right orientation will help you to identify this ligament. This long axis view of the AITFL shows a fibrotic appearance after a previous trauma. The ligament is remarkably thickened and inhomogeneous. Notice it's starting from the fibula and coursing into the tibia. Here is another long axis view of the AITFL, which shows a loss of normal fibrillar continuity with heterogeneous echogenicity. This finding reveals a complete tear. Here is a long axis view of the posterior inferior tibiofibular ligament, and as the name of the ligament is described, you can see how it is a homogeneous and fibrillar and echogenic structure that starts from the tibia and courses to the fibula. And now we're going to move over to the medial side of the ankle, where we can see the tibiocalcaneal components of the deltoid ligament. Notice that it is normal, fibular, and homogeneous in nature, spanning the tibia to the calcaneus. Notice the relationship of the posterior tibial tendon to the ligament and how it is more superficial than the ligament. And here you can see another long axis view of the tibiocalcaneal ligament. However, this time there is a partial tear. Notice that the ligament is not as taut as you had seen it in the previous image, and there is some hypoechoic effusion as well as a wavy, inhomogeneous nature to the ligament. Here is a great longitudinal axis view of the tibio-navicular ligament, which is a component of the deltoid ligament. Notice how it does not have any attachments to the talus, but rather it hugs it, and it spans from the tibia all the way to the navicular. Notice the homogeneous and fibular nature of the ligament and how it has a normal appearance as we have seen previously in other ligamental images. And here we can see a long axis view of the anterior tibial-talar ligament, which is one of the two deep components of the deltoid ligament. There is a steep learning curve with identifying this structure, because not only do you have to have the correct orientation, but you have to have also the ability to rotate your ultrasound probe in order to identify it. Here you can see it has that same normal echogenic fibular nature as we have seen in previous images. Thank you guys so much for watching. I'm excited for the next video in this ultrasound series, so stay tuned, you guys. Thanks.